Welcome to Infertility and Me podcast, a show that amplifies diverse stories about the struggles of infertility and fertility in a safe space. Our goal is to normalize fertility stories that validate, give hope, and create a community where no one is left silently suffering. You guys, thank you so much for tuning in to another episode of Infertility and Me. I am your host, Monique Farouk, infertility advocate, women's health advocate, and IVF mom to one, Omar Jr. If this is your first time listening to Infertility and Me, welcome, 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 friend. You guys, thank you so much for being here on Infertility and Me. Just a few quick announcements before we get into our episode today with a young lady named Lindsay Blair. So, if you guys aren't following on Instagram, get on it. Infertility and Me podcast, okay? Questions, comments, feedback, info at moniquefarouk.com. If you'd like to share anonymously or publicly on the show, info at moniquefarouk.com to submit yourself, or you can tap the show details and go directly to the website and you can submit yourself there, or you can submit from Instagram as well. Either way, I'm here for you guys. I want to hear from you. And then also on Patreon, you guys. Join me on Patreon. Not only would you be helping the continuation of Infertility and Me podcast, but you could be part of private community and meet other friends in the community away from and outside of social media. You wouldn't have to worry about scrolling and seeing pregnancy pictures, announcements, or all of those sorts of things. It would be very, very private and only exclusive to our Patreon community. And after you have been with the community for a few months, you will receive a very special gift of thank you from me to you for joining and supporting the show. And our private community is also a part of Discord chat instead of some other platforms that are out there, so that we can chat with each other on a daily basis, weekly basis, however you guys want to do it. And that is a part of your membership as well in the private community, as well as being able to connect with others who have similar experiences as you, and it just being an overall safe space for us to get to know each other a little bit better. And we'll have our monthly Zoom check-ins with one another, and that also comes with the membership. So join me on Patreon, you guys. Support the show and find your tribe. So today our guest is Lindsay Blair. She is certified in trauma and well as being a birth and bereavement doula. Lindsay and her husband suffered many losses beginning in their early 20s after they got married. They've been through a total of 8 losses before finally getting their BFP with their twins, one girl and one boy, through IVF. And it was just very tumultuous, you guys, very tumultuous. So today you will get your dose of validation and overcame her suffering. And so if you're someone, if you have suffered some losses along your path to motherhood or fatherhood or parenthood, this episode is surely to resonate and you do not want to miss it, because Lindsay details for us the various things that she did to overcome and to heal and to move through all of her grief and loss, and then also being a pregnant mom through IVF and how she navigated that as well. So you guys can connect with Lindsay at Catalyst for Courage on Instagram. Her information will be in the show details so that you can tap and go and connect with her. And so we'll be back in just a second with Lindsay. You guys, with our girl Lindsay Blair. Lindsay girl, thank you so much for coming on the show today and speaking to us about all of your losses, and then how you got to be a mama. Appreciate you.
Absolutely. Thank you so much for having me. I'm excited.
So you guys, Lindsay's been through quite a lot, like I spoke to you about in the intro. So we're gonna get right into it. So Lindsay, tell us how you met hubby. How did that all go down?
We are college sweethearts. So we both
Oh,
went to Clemson University and we met, I believe it was our junior year. So we didn't meet when we started college, but we before we graduated, we met and we became fast friends. We honestly were friends for 2 years and I didn't even consider him as an option. He's a little bit younger than me and I have two younger brothers. And so I think there was a part of me that was, anybody who was younger than me, even by a day, was,
yeah, it's too young, right?
friend zoned instantly.
Yeah, for sure.
And so I didn't even think about it. And then some other friends started kind of pointing it out to me that we really had a lot in common, that we,
Mhm.
had I thought about it, had he thought about it. And long story short, we started dating and we got married very shortly after we started dating. We started dating in August of 2012 and we were married by October of 2013. So once we
Oh,
knew, we knew.
what's your anniversary date? October.
October the 13th.
Oh, that's right after my birthday. My birthday's in October. Ah,
Oh,
I love
October's a
October
great
weddings.
month.
It's so beautiful. Yes, weddings are so beautiful in October. I love it. So when you guys got married and like while you were in college, you know, us 80s babies, we were the poster children for birth control. And they pushed
Hmm.
it on us hard. And in the late 70s babies too. And so, were you one of the ones who always prevented pregnancy, did everything you can to protect yourself, of course? And so, when the time came that you guys got married, had you guys discussed having children? And was that something that you knew you wanted to do? Do you always know you wanted to be a mom?
I did. I did always know that I wanted to be a mom. I also had a 3 to 5 year plan for myself and for David and I did together. We wanted to wait at least 3 to 5 years because we got married so young. We were really still, I think we were 22 and 23 when we got married. So we were young and, I kind of thought that I would want to have kids before I was 30, but we were in no hurry. We wanted to spend some time kind of building our marriage and building our relationship. So I was on birth control when we got married, and I was on birth control, took it religiously. I'm not very organized. At least I used to not be. I'm a lot more organized now that I've gotten older. But I was kind of flippant with my birth control. I would sometimes forget to take it, or I would, instead of taking it at the same time every day, I may take it in the morning one day and at night the next day. So unexpectedly, when we were married for only 6 months before either of us really had a real job yet, or even had graduated college, we were still in school. We
Okay.
found out that we were pregnant, which
Wow.
was a huge surprise. My mom went through 3 years of infertility. My grandmother actually
Mm,
went through infertility, so I kind of always suspected that I may have some problems. So we
mm,
were shocked that we were preventing pregnancy and that we got pregnant so easily. Um, we were terrified, because we this wasn't part of our plan, but we quickly were very, very excited about the idea because we knew that we always wanted to be parents. We knew that we always wanted to have children. It just, was happening quicker than we thought. But we were then once again shocked when just a few weeks into our pregnancy, at about 8.5 weeks, right before our first ultrasound appointment, we actually, had a miscarriage. And being so young and naive a little bit about that, it was just really shocking for us. It was really traumatic. It was not at all like I expected it to be from what the doctor explained, and we were just kind of felt like we had the rug yanked out from under us.
absolutely. I can imagine so. And then, like, at that age, like, even you guys being in a marriage and in a really committed relationship, it's like not really thinking about kids that much. Like, you're going out partying at bars as a couple together. You know what I mean? Like, you're having the best
Yeah.
time of your freaking life. And so, yeah, I can see how that would be like really devastatingly shocking and just hurtful because you start getting used to that idea, right? That's how it happens. We get pregnant and we get used to the idea, and then we miscarry and the baby doesn't survive, right? So,
Mhm.
wow, yeah. So, where did you go from there? Did you guys begin to pursue parenthood more after that, or did you just spend time with your marriage, getting to know each other more as a married couple, and just healing from that?
Yeah, we at that point, I feel like something was unlocked in us, and we just
Mhm.
so desperately wanted to have a baby, with us, a living child to raise and to love. We had all this love for a child, and no child here on earth to love. And so we, at that point, were trying to conceive again. And that became, a part of our journey. And we knew that having another pregnancy couldn't replace, the baby that we lost, but we so desperately like wanted to be pregnant again. And so we did conceive again in October of that year. And so we had our miscarriage in May of 2014 and we conceived again in September. And unfortunately, at 6.5 weeks, we experienced our second miscarriage. And at that point, our doctor referred us to a infertility specialist for recurrent pregnancy loss because with our age and medical history, she said that one loss can be, you know, not normal, but it can be common. 1 in 4 pregnancies end in miscarriage. But having two in a row at 23 years old when everything else looks normal and fine is worth looking into. So at that point, we began seeing a fertility specialist and just continued on with our journey. And I can go into as many details as you want to know, but we saw a fertility specialist and went on for another 6 years experiencing unexplained recurrent pregnancy loss.
But you know what? I will say I do like the way that your doctor was very proactive in sending you to a specialist short period of time because it was within the same year, right? The first two that you lost.
It was.
Yeah.
They were about 6 months apart.
Yeah, see, I love that. I love. Shout out to your doc back then for being proactive about that, especially with your age. I think a lot of times we get brushed off when we're in our 20s like that, and something happens along those lines, and they'll like, well, you're young, your body's not used to that sort of a thing, and they'll brush it
Hmm.
off instead of just sending you to a specialist to get further diagnoses. Even if they refer you directly to a radiologist for HSG or something like that. But I really love that your doctor was proactive, and so when you guys saw the specialist then what did she or he do to try to get you guys some answers at that point?
Yeah, when we saw our reproductive endocrinologist, he started by doing, all of the basic blood work, checking thyroid levels, checking different hormone levels, checking just, any looking for any indicators in my blood work that could explain. I think he even looked at chromosomal, markers in my husband and I, just to see if there was anything there. And every test that he ran came back completely normal. And then we started looking for anatomical issues that could cause recurrent losses, like if I had anything in my uterus, if I had any scar tissue or a deviated septum, looking at my tubes if there was any issues with my tubes. And every test that was done came back perfectly clear. And so the only theory that he had at the time was that my cycles had always been a little bit irregular and tended to be a little bit longer than the normal 28-day standard, which I don't know if anybody actually has a 28-day cycle. I feel like no, nobody really has exactly 28 days. Maybe they do, but mine tends to fall anywhere between 30 and 37 days, kind of somewhere in that ballpark. And so his theory was, let's try putting you on some medication just to regulate your cycle and get you to ovulate a little bit earlier, and maybe that would help. And so we tried that for a few cycles. I think it took us 2 or 3 rounds, and we conceived again. And we had our third miscarriage, and then we had our fourth miscarriage. And then we found out that we were pregnant a fifth time, and things were looking okay at first. It was the HCG was kind of doubling like it was supposed to, which in the past we've kind of had some early indicators with the HCG levels and the progesterone levels that things didn't look right. Um, the progesterone levels this time did not look great, but the HCG was looking good, and I was on progesterone supplements. And we came time to have an ultrasound, and we did the ultrasound, and we could not find anything. There was no sign of a pregnancy at all in my uterus. And so at that point, he was very suspicious that it might be an ectopic pregnancy. And we did determine that it was an ectopic pregnancy, and I had to have emergency surgery the very next morning, where I lost my fallopian tube and my fifth child. And so that was, another layer of the grief and of the trauma. Just 1 minute you're pregnant, and the next minute you're having surgery, and realizing that ectopic pregnancy is a life-threatening condition. And so that was really hard. And then also knowing, okay, now I only have one tube. What is that going to mean for my natural fertility? And surprisingly, we actually did conceive with one tube. Um, I think 2 cycles after I had healed from my surgery, and unfortunately, we had our sixth pregnancy loss. And so it just kind of felt like a merry-go-round that we were stuck on with no answers, with no reason. And then little by little, different pieces of my fertility that were good and that were working for me just kept, getting taken in a sense. So it just kind of felt like, it was bad news after bad news after bad news, just over and over and over again.
Like going through all of that so young, Lindsay, so very young, dealing with that type of trauma. Oh my gosh. I know you probably had a very strong support system with family, right? And friends, especially your mom, since she had been through some infertility as well. And
Yeah.
it must have been really tough being a newlywed and dealing with all of that at the same time. Oh my
Yeah.
gosh. So, how did you guys navigate that as a couple and you as an individual trying to be this new wife, trying to come into this life together?
Yeah, it definitely impacted our relationship and our marriage. I think that we all go through things differently, even if we share an experience with a partner, with a loved one, and we went through the exact same thing. We all process it differently, and we need different things. And we need different, support in different ways. And I'm very grateful for our family and our friends. They really wanted to support us, but I think sometimes it's really hard to know how to support somebody when you're going through the journey, when you're going through infertility or going through pregnancy loss. And for us, like, we just didn't know where we fit, because here we were at a fertility clinic week after week, month after month, with, surrounded by women who are just are hoping to see a positive pregnancy test. And for us, that, we've seen a bunch of positive pregnancy tests, but it was
Mm-hmm.
like a unique form of infertility where
Yes,
we
I
could
agree.
conceive,
Mm-hmm.
on our own with pretty little help or support or interventions, but we couldn't sustain like the pregnancy. And so it was just kind of this weird place where I didn't know really where I fit. Like, did I fit in the infertility community? Did I fit in the, recurrent pregnancy loss community? Because that, there's a lot less people, fortunately, in that community. I think it's 1 in 100 is the statistics for that, whereas infertility is 1 in 8. But I just didn't know, like, where I fit and where my story was. And so that was hard too, because you hear a lot when you go through pregnancy loss and recurrent pregnancy loss, even while you're trying to conceive and are seeking fertility treatments. You hear a lot of, well, at least you can get pregnant. Well, at least,
That
your
will at least.
body can function. At least,
Oh my
you should be
God.
happy. At least you've seen a positive pregnancy test. And here I am, like, well, I don't know if I'll ever see a baby. Like, I feel the same as you. Like, that hasn't seen a positive pregnancy test. Like, the likelihood of bringing a baby home doesn't seem like in the cards for me right now. And after going through recurrent loss for years and years, and we did go on to have several more miscarriages and even a second ectopic pregnancy, where I once again went to emergency surgery and lost my second tube. And so now I truly belonged in the infertility community,
Yeah.
because that was my, again, like, I just felt like pieces of my fertility were, taken, one by one, like losing my tubes and losing just the ability to conceive without assisted reproductive technology, which I'm so grateful for. Thank God for IVF, or I would not have my miracle babies. But like, without that, I, can't conceive on my own. And so that was just, another layer again of the grief and the trauma and the loss that we experienced. But that was a hard thing of just kind of determining where I fit, and not really feeling like my story looked like anybody else's stories that I was seeing at the time, or that I knew at the time when I was going through it.
Yeah, that's a great question that you asked there with where do I fit in? And I think that a lot of other women and couples who are experiencing recurrent pregnancy loss and not necessarily having a reason as to why it's happening, because you don't have a PCOS or an endometriosis or fibroid diagnosis, whereas though there's some kind of insight and awareness of this possibly being a contributing factor to your recurrent losses and such. So I think, yeah, I empathize for you guys in that way, and I'm pretty sure that there's somebody listening that can resonate with that. And I think what's so funny is that we go through life in adolescence and as teenagers and even younger than that, and we're always looking for that place we fit in, right? And You just know when you're an adult. Finish school, you do all those things, and you're at this company, and you got this culture, or you're building a business, and you're building your own culture. You just know that you're going to have your people in your tribe, and you're going to be able to live life knowing exactly who you are and where you're going. And then when things like this happen, it makes you question everything, right? So,
Hmm.
being a new grad, going through all this trauma, and I did want to ask you, were you having early miscarriages, like within the first trimester, or were they in second trimester?
Yes, they were all first trimester losses. So some of them very, very early, like between 4 to 6 weeks. So, just seeing a positive pregnancy test is the only proof, that I have that they existed. And then the latest losses that we had were right at 8.5, 9 weeks. So it was all very, very early. We did get to see, several of them via ultrasound and see their heartbeat and things like that, which was good to be able to see, but also hard too, because then once you find out that you're losing the baby, then it's, you have more memories and more of a bond that you've gotten to know
Mm-hmm.
them a little bit more.
Mm-hmm.
And so that was really hard too. But yes, all of my losses were first trimester losses. So my only regret as far as therapy goes is that we didn't seek therapy sooner. I think we waited maybe 3 or 4 years into our 7 year journey before we saw a therapist. And we both, we did lots of therapy. We did individual therapy. He was seeing his therapist. I was seeing my therapist every week. And then we also did couples therapy because when you go through infertility and loss, like it impacts everything. It impacts your relationship. It impacts your sex life. Like that's something that I was totally not expected for, that my sex life was going to be so
Oh my
impacted and that
gosh.
sex was now triggering. And,
Mm-hmm.
like it reminded me of that this was this act that was supposed to be fun. And now, it feels transactional, or now it just reminds me that we can't get pregnant on our own. Or now it just reminds me of the time that we did get pregnant with our baby who we miscarried. And so it just became really triggering. And so we actually sought a therapist specifically to help us navigate that part of it, because that was something that we missed and we grieved, because here we were newlyweds and our entire marriage pretty much has been wrapped up in the grief and loss of infertility and recurrent pregnancy loss.
Yeah. Ooh, that's a lot. That's the unspoken truth right there. The sex life, man. Every time, unfortunately, as a woman, especially if you're the one with the diagnosis, heterosexual or LGBTQ plus IA, doesn't matter. It is a reminder of what won't happen after this. Mm,
Mm-hmm.
wow. Yeah. That's yeah, that just hit me really because I had struggles with that, and even though we're not trying for a sibling and such like that, it's like I was looking for that ray of hope too. Like maybe this will be the time, the miracle. And
Mm-hmm.
then for you losing both of your fallopian tubes and even just the one. Let's get it more into that because there are so many women also dealing with it. I feel like your story has a little bit of everything in it, girl. Like you got twins, you got the BF positive, you got fallopian tube issues, because of the ectopic pregnancies. Like,
Mm-hmm.
oh my
We did
gosh, it's just
IVF.
so
We're
much. You
part
did
of the IVF
IVF, like
community.
you got pregnant naturally. It's a little bit of everything in your journey. Oh my gosh, what a whirlwind. But I'm so glad that you guys got help. I'm an advocate for it. And I preach it all day, every day, because no matter what you think about, because some people make that disclaimer like, well, therapist is going through things too. Okay, but so what? But they have the tools that you need, right? A coach has the tools that you need. They've been taught these things to help you. So kudos to you guys for doing that and doing it, when you felt called to do it. You know what I mean? And so for the loss of your tubes, tell us how that felt specifically in regards to as a woman.
Yeah.
Mm,
It's it's complicated in a way. With ectopic pregnancy, I think it's definitely, not as common as other forms of early pregnancy loss. And I think sometimes people can kind of separate it in their mind as maybe not a legit pregnancy because it doesn't have a chance to survive, which is true. Like that is a fact. Like an ectopic pregnancy in a fallopian tube cannot survive, it cannot develop into a full term baby. And it is a life threatening condition for a mother, but it's still a baby, and it's still a very wanted pregnancy in many, many cases. And so you're in this unique position when you're going through that of you're now signing consent forms to terminate your pregnancy, your much wanted pregnancy, in order to save your own life. And so you're having to make decisions that you don't normally have to make in early pregnancy loss. The decision is made for you. You lose the baby, and that's what happens. But with ectopic pregnancies, like my second ectopic pregnancy, we saw them on the ultrasound. You're given a couple of options. Usually, if you can catch it early enough, they can
Okay.
try to treat the pregnancy with a chemotherapy drug that targets rapidly dividing cells. And so we tried
Okay.
that with our second ectopic pregnancy to try to, in an attempt to preserve my tube, because they couldn't see the baby on the ultrasound. They couldn't find the pregnancy. And so there was, they thought maybe we caught it early enough. You can try this chemotherapy drug and see if that can save your tube and, terminate the pregnancy. And so we tried that. And unfortunately, the HCG levels were still just shooting up. We had to get them drawn every couple of days. And so the pregnancy wasn't being terminated. And so I pushed actually for a second ultrasound because I was just like fed up. I'm like, I'm not going to do another chemotherapy injection because it's has terrible side effects. I was miserable. It delays every time you have an injection of it, it delays the amount of time that you can try again, because you now have chemotherapy in your system. You have to wait until that, months for that to get out so that you can try again. And I was just like, we need to figure this out. Like, where is this pregnancy? And so we pushed for a second ultrasound, and I went by myself. My husband was at work, and the doctor was like, well, I don't see it. I don't see it. And then the ultrasound tech was like, wait, what's that? And lo and behold, on the screen, you see an 7.5 week baby, heart beating, growing, and then there's a pool of blood. And so they could tell that it was in my tube and that my tube had now ruptured. And so at that point, they're shoving consent forms in my face saying, we're taking you to surgery right now. You need to sign this waiver, call your husband, call whoever we need to go right now. And and so when that was a whirlwind. And so I think sometimes it's hard when you have an ectopic pregnancy to even process what's going on and even process the grief and the loss, because there's so much of that heightened, state of emergency that's kind of, going on when you're being rushed to surgery. And so, but in the aftermath, I don't think that I really was able to grieve the loss of my tubes and what that meant for me as a woman until like a little bit later, after I had, kind of settled from the trauma of that and the shock of that. But just that feeling of knowing that, like my tubes are gone permanently, like those, that can't be reversed, that can't be undone. And just that, identity that I think that as women, a lot of us carry, that this is what we're created to do. This is what we are meant to do. We have these body parts that are, supposed to be able to conceive and give birth. And whenever those body parts are taken from us in a way like that, it just kind of, it causes some feelings of, man, like, who am I? And what does this mean? Like, am I a woman? Which the answer is, of course, yes, I am. Like, we don't
Mm-hmm.
need we don't
Mm-hmm.
need anatomy to define our
Mm-hmm.
womanhood.
Mm-hmm.
Our womanhood is within us, and
Exactly.
but it doesn't always feel true in the moment. Sometimes you can grieve that and can feel less than because a part of you is missing.
Yeah, definitely. And I often, because I see so many and meet so many women like you who've had to have certain organs, reproductive organs removed. I always wondered how much more of a layer of trauma that adds to you and how you feel on top of everything else you're going through and how difficult that is. And sorry, you guys, we had a snowstorm, so you probably heard the snow being coming by with the shovel. Sorry about that, you guys. So yeah, I just hate that it has to happen. Like my mom, she had a partial hysterectomy, and she was like, I just couldn't let them take the whole thing because she had
Mm,
fibroids, really massive fibroids. She was around my age, 38, when she had them removed. And she was like, I just couldn't let them do the whole thing. She was like, I had to have partial, and I think we have to do what's best for our bodies and for our health. And
mm,
so, wow. Yeah, that's a lot to deal with and go through, and then trying to console your husband, right, your spouse, and then, oh yeah, yeah, that's a lot. So after you guys had your last miscarriage, was the last one a miscarriage or ectopic? The
Our
last,
last one was ectopic, actually. And so that was our eighth loss. And that was back in February of 2018. And so that just, I think, everything that you just said and everything that we've talked about losing the tubes and just, you're losing your natural fertility and losing your eighth child, like all of those feelings was just so much that we kind of just decided to take a break. We had never actually taken a real break in our journey. We had taken the medically recommended breaks before trying again, but we
mm-hmm,
were pretty much just chasing this dream of trying to conceive and have a baby as soon as time would allow, and hoping and praying that things would work out. And at this point, we just were like, we need to breathe. We need a second to actually focus on our marriage, focus on our relationship, focus on our work, focus on just us as a family of two, and realizing that we already are a family. And I think a lot of people, I can't stand it when people say things like, oh, when are you going to try to have a family? And it's like, no, like if you are in a committed relationship, like you are a family, like the two of you are a family. You don't, having children doesn't make a family. They are an addition to a family. Your family can grow with children, but children are not a qualifier for defining what a family is. And so I think like that was really, really good for us, my husband and I, to just take some time. And we didn't put a limit on it or a length on it. We just said we need to just stop until this feels better for us, and until we feel like we can get some healing and catch our breath again. Because for me, I could not imagine being pregnant again, just the trauma and just all of that. I could not imagine another loss. Like, I truly thought it would kill me. I was like, if I have another loss, I don't think that I'll survive. And, that was just kind of a wake up call that this isn't healthy for me right now. Like, I need to prioritize my mental health. I need to prioritize my physical health. I need to prioritize my relationship health, like with my husband and all of that stuff. So it ended up being almost 2 years before we kind of felt like, taking another step. And during that time, we were, kind of holding an open hand. We knew that we wanted to have children, but we were kind of like exploring all kinds of options. We were like, should we try with using a gestational carrier? We had some family members who had, reached out to us and said that they would consider doing that to help us if that was something that we wanted to do. We were considering adoption. We were considering, all kinds of things. We were considering foster care. We had actually fostered a few years prior. And so we were just kind of like thinking through it and open to whatever path, felt right for us. And but we weren't spending really any time or energy like talking about it anymore. We just kind of took those conversations off the table while we were really focusing on our healing.
and when you guys were on your break, what sorts of things did you do to, I guess, reconnect with one another as a couple, and then just as an individual, as a person, how do you felt you grew during that time?
Yeah, one thing, I mean, we were in therapy, so that was really good and really helpful. I actually changed jobs. I started a new job, and that was kind of good to just have like something new. I had a new energy for it, a new path. It
Another
was the same
goal.
field.
Yeah.
Yeah, it was the same
A goal
field that
that
I was
wasn't having a
already in.
baby. Right, exactly.
Yes, yes, something else to kind of focus on and focus your energy on. And then together we just really focused on dating each other because we were still young, like, and you're never too young to date your partner. And we just had fun. We played games, we traveled, we went to Greece, we,
Love that. Great.
explored.
Yeah.
Yeah. We played on the lake, went hiking, like just we both love water sports. So we just kind of focused on having fun because I think when you're consumed, which we were with infertility and loss and grief and all of that, it's hard. You kind of forget how to have fun. And so we just kind of spent a lot of time relearning that together and like, how do we have fun? Because we should be having fun, relationships are supposed to be fun and
Yeah.
life is meant to be enjoyed. And even in the midst of hard things, you can still give yourself permission to have a good day. We should expect that we will have good days.
Ooh, that's quotable. That's quotable right there. I love that. I like that. In the midst of struggles. Yeah, I love that. I'm gonna have to when I do my editing, I might have to make that into a clip for this episode. That's a good reminder. That's a good reminder, and I'm loving all of this fun stuff that you guys were doing. Hopefully, somebody will get an idea to do something like that for themselves. Because like in the midst of treatment cycles, going through IVF, sometimes people will take breaks. Like, okay, we got this quick week we have right here. We got this space and window time. Okay, so you guys heard it here. Lindsay's giving you some ideas. If you got some break time, go ahead and take a break. Go to Greece, do something, go hiking or something. I love that. And so, how was it going back to the conversation of trying again? Because you guys are close to 30 by this time, right?
Hmm. Yeah, so we kind of looked at each other one day, and because we kind of would check in every now and then and just check in, hey, how are you feeling about, infertility and loss and next steps, all that stuff. Like, how are you feeling? How are you? But, we would kind of keep it intentional and keep it short and brief. Like, okay, we're going to check in once a week or once a month or, whatever it was. And it was in the fall of 2019 that we just kind of like looked at each other, and I remembered saying to David, I don't know if I'm insane, because the definition of insanity is doing the same thing over and over again and expecting different results. So maybe I am actually insane, but I've kind of been feeling like I want to try again to do another embryo transfer, knowing all the complicated feelings that would come with that, knowing that the likelihood of us experiencing another loss were very high, and knowing all of that. But I felt like I had healed to where I felt like another loss wouldn't kill me, it wouldn't destroy me, it would hurt, and I of course didn't want that to happen. But I, at this point in my healing, I knew that I would survive, and I would, that I was resilient enough to where the loss like wouldn't destroy me, and it wouldn't destroy our relationship. And so I was, willing to take the risk. And David actually kind of laughed, and he said, honestly, I've been kind of thinking that too. So we were on the same
Yes,
page.
right.
Yeah.
Make my job easier.
Yeah. Which doesn't always happen too. And so, that, we haven't always been on the same page every step of our journey, but for this step we were. And I think that that's a hard thing to navigate too with couples. If you want one thing and your spouse wants, or your partner wants something else, just kind of, how do you get through that? And so, thankfully for us with this, we were on the exact same page. And so we talked to our doctor and went back to the clinic, and all the feelings, that come when you go back to the clinic again. It's just feels fresh
Nostalgia,
all over
complete
again.
nostalgia. Yeah, yeah.
Yeah, just all the same emotions that you felt sitting in the waiting room and the same ultrasound rooms and same doctor. And I just remember sitting down with our doctor and asking him again, are we insane? Like, is this crazy? And he said, I don't think so. And he said, like, nothing really has changed in 2 years. And that was my second question, was, has anything changed in 2 years? Is there any new, since we've been here, is there any new science or new protocols, any tests that we can look at for recurrent loss to, maybe help make this outcome different? And he said, there really isn't. But I still think that this could work for you. We had already done IVF 3 years prior. So we had embryos, gratefully, that were in storage. And we had already done like the genetic testing on the embryos, because that was a theory. That was why we did IVF to begin with. I hadn't lost both of my tubes yet when we had done IVF. And originally, and the theory was that maybe just an abnormal amount of our embryos are chromosomally abnormal. And so maybe, he expected to see when we did the PGS testing that most of them would be abnormal, but maybe we could find, one that was normal. But
Mhm.
oddly enough, they were mostly normal. They were 80% normal, just, which is, typical for any healthy statistics for people that are our age that we're trying to conceive. So that was a little bit surprising. But so we had embryos in storage, and he even was willing to transfer too, which our clinic absolutely does not do, especially with PGS tested embryos.
Mhm.
But he was willing to do it. You know, for us if that's what we wanted to do. And that's kind of what we decided. And so we did just the standard, he calls it the gold standard protocol for embryo transfer. Just, we had done it before with our first embryo transfer. This was actually our third embryo transfer. And against all odds, it stuck, and we have our twins as a result.
Yeah, and so you have a girl and a boy. That almost feels complete. That's like the ideal family situation. I feel like for a lot of people. No offense to anyone who doesn't care about what kind of genders they have, but
Mm-hmm.
I do feel like that's like the American standard is to have a girl and a boy. It's
Mm-hmm.
somewhere in there. Some kind of way. So, wow. So you guys. So what happened when the week of beta comes up? You're right. So like were you testing at all, like early testing or anything like that, or did you do your blood work and you just stuck with that?
Yeah, this we had been around the block at this point with we were no stranger to the 2 week wait, naturally or after a frozen embryo transfer. This was our third transfer. And so I remember with our first transfer and even our second transfer, we did some early testing. We just, the second transfer, I went all in with, I was gluten and dairy free for like 3 months before. I did the acupuncture, I did the fertility massage, like did all the things. And our first embryo transfer was an early miscarriage, and our second embryo transfer was a big fat negative. And that one hurt, more than I expected it to, because, I expected it to hurt less than the first one because the first one was a pregnancy and then a miscarriage. But honestly,
Hmm.
that negative, big fat negative, I think hurt deep on a deeper level because we had tried everything, like we had even switched up our protocol and tried a lot of like promising trending things, and
Right,
it
right.
just didn't work. And so that was devastating. And so this third embryo transfer, we were like, we're going to do this differently. And I was like, I'm not testing early. I'm just not going to do that. I'm going to enjoy, try to enjoy as much as I can this 2 week wait, this 10-day wait until beta, and just try to be positive. I didn't do any acupuncture. I didn't do any weird or like crazy dieting things. I didn't eat the pineapple cores. And I was just like, you know what? Like, I've tried all of that. I'm just going to live my life and like
Right.
try as much as I can to not think about it and focus on focus on my relationship with my husband and my job and just my dogs, and just try to enjoy this, and that I am pregnant right now, and beta day we will find out one way or another. And so we actually went to work on beta day. Like I went that morning, got my blood drawn, went to work, my husband went to work, and then I remember I called him around the time because I told the nurse when to call because I wanted us to find out together on the phone. So I was sitting in my office and he was sitting in his office, and the nurse called, and I'd called him first. And so we were on the phone. I was like, okay, the nurse is calling. And so I answered it and merged the call. And then she, told us that it was positive, and she said it was very positive. So my HCG was over 1,000 for that first beta, which it had never been that high. I've had HCG levels as low as like 11 before on an initial draw. So this was a shock, and at that point we kind of suspected that both embryos might have stuck and that we might be pregnant with twins.
Wow. What a major turn of events, right? You had all those losses and back for your trouble. And, wow. Well, congratulations to you guys. I know your babies are what, coming up on 2, right?
Yeah, there'll be two in October. So October is our month. That's our wedding month, and they were born
Yes, I
3 days
love
after
that.
our 8th anniversary.
Yes, I love that. I love that. So moving into motherhood and being pregnant, how was it with pregnancy? Did you go all in and just took it one day at a time and you said, you know what, I'm just going to try to enjoy this pregnancy after so many losses and going through IVF and all the things?
Yeah. I certainly tried to enjoy pregnancy. I took all the pictures, every week, just did I had this pair of leggings that I had bought, I think 3 years prior, that had storks on them and like had like blue and pink little baskets that the storks were carrying. And so those were my leggings that I had worn to all of my embryo transfers. I wore them the day of my egg retrieval. So they were, a staple. And I knew that one day if I ever became pregnant, and was able to carry a pregnancy to term, that I would wear those leggings for like my weekly progress pictures. So I did that. But pregnancy after loss is no joke. It's just, I don't care how much therapy I did, like that anxiety is going to be there. It's just going to be a part of it. There's not really a way to escape that when you've been pregnant, when you're pregnant after loss, or even if you're pregnant after infertility. Like, so much goes into that and so much waiting, that I feel like everybody who's pregnant, or most people who are pregnant after infertility or loss, are just, you're just kind of waiting on the other shoe to drop. You're just kind of waiting for the
Mm-hmm.
inevitable bad
Mm-hmm.
news, because that's been your experience so far. It's just so much hope deferred and hope delayed. Like, you've put hope into
Mm-hmm.
treatments and they haven't worked, and you thought that you would be able to get pregnant when you wanted to and you weren't able to, or you expected to have a baby 9 months after seeing a positive pregnancy test, and instead, you're seeing a negative pregnancy test sooner and you're having a miscarriage. And so, that's tough. And pregnancy after loss for me was challenging, like, arguably just the same kind of level of challenging as going through a loss was. Like, just battled, the anxiety, daily. And so I took it one day at a time, and just tried to, practice as many grounding and, affirmations, and just practicing, choosing hope, and just trying to believe, like, today I'm pregnant, today my babies are okay. And we had some scares during our pregnancy. And so it was a fairly easy
Mm-hmm.
pregnancy, considering, like, I wasn't at risk of preterm labor. I wasn't put on bed rest, or I wasn't hospitalized, or anything like that. That multiple pregnancies can be very high risk, but ours was not any more high risk than normal. But we did have some bleeding early on at 6 weeks, and right before our first ultrasound. And so I just knew at that moment that I was having a miscarriage. I just knew, because it was so familiar. It was the same symptoms, and I never had any morning sickness, um, which maybe I'm just one of the lucky ones
Ooh,
that never
that's an
has morning
anomaly right
sickness.
there.
I know, but
With
not,
twin
I've never had
pregnancies.
morning sickness at all. Yeah, not even a little bit. And so I was concerned about that. But anyway, at 6 weeks, we went in for bleeding, and they had like a subchorionic hematoma, and that was causing some bleeding. And then we did find out that we were initially expecting triplets. One of our embryos split very early on, and didn't progress past like about 4 or 5 weeks. And so that was kind of
Wow.
a mixed emotion too with that, because we found out we were having twins and that there were two hearts beating, and then we also found out that there was a third baby that didn't develop. And so there was a little bit of, that grief and joy kind of mixed
Mm-hmm.
together.
Mm-hmm.
But then I think because of that early loss in our twin pregnancy, you know, you kind of expect, like, oh, well, something has gone wrong. Like, that you kind of have expected or seen the reality that you could lose one of your babies, while you're pregnant with a healthy one. And so
Mm-hmm.
the fear was that we could lose one or both of the twins at any point. And then we had another bleeding scare at 16 weeks. And then I started having contractions at 23 weeks that turned out to be Braxton Hicks. But, so I would go to triage. I went to triage, I think 3 times, OB triage, when I was pregnant.
More well than
Just,
you should than you wanted to. I'm sure. Oh my gosh.
I had a handheld Doppler that whenever I would feel anxious, I would, be able to check their heartbeats that I ordered
Mm-hmm.
online.
You got
So
to
it
do what you
was,
got to do. You got to do
hmm
what you got to do. I did some of the same things. I had. I pulled out one of my old nursing. Like, I wasn't an RN nurse, but I worked in the nursing field, and when I was in my early 20s, and I was aspect of things, and pulled out one of my stethoscopes and was listening for the heartbeat in the second trimester. So I resonate with that. Yeah. Oh my God.
hmm you have to do what you have to do for sure to get through it, because pregnancy after loss is just, and after infertility is just hard.
Yeah. Great what you said earlier. I think that's an important part to also highlight is when you said, oh, you're doing the work to get help. Don't be surprised if those emotions rise back up. But when they start to arise again, because you're human. And I think we
Right.
forget that. Like, I think we forget that even though we've come so far with healing, like, those things will still try to come back up, because when you lose babies, and if you lose a partner, if you lose anybody in your life, the pain subsides, but it truly never leaves you in a way. Mm-hmm.
And I think that's so true because with pregnancy after loss
Mm-hmm.
specifically, and I'm sure with infertility too, that hasn't been my story, so I don't want to speak too much to that because I don't truly know. I truly don't know what that's like. But I'll speak from my experience with pregnancy after loss. It's so hard because sometimes people dismiss your fears and your anxieties, and because, oh, well, the chances of this going wrong are very, very low, and the chances of that going wrong are very, very low. You don't need to be worried about that. But when you've been pregnant before and you've experienced loss, like, you've already lived the worst case scenario, like the thing that's not likely to happen. I was 1 in 100, with recurrent pregnancy loss. Like that's only 1 in 100 people. Like, you normally hear statistics like that and you kind of think, oh, well, I'm good, but when you have been that 1 in 100 or that 1 in 8 or that 1 in 4, your experience of getting bad news or of loss has been like 100% of your experience. Like, that 1% starts to feel a whole lot like 100%. And so it's normal to feel anxious after, when you're pregnant after loss or after infertility. That's completely normal because your experience has been to hear bad news and for things to go wrong. And so it makes sense. And I'm a fertility coach and a birth and bereavement doula. And so I tell my clients all the time that we prepare for the ups and the downs. We prepare that this is going to be really, really hard. You're going to have hard days. You're going to have anxious thoughts. You're going to have, um, reminders of your loss or of your experience. And so we know that that's coming. And so we just prepare for, how are we going to get through it? How are we going to get through it today? How are we going to get through it for the next 5 minutes? And sometimes we break it down because thinking of 9 months of feeling anxiety every single day can seem suffocating and completely exhausting. But if
Mm-hmm.
we can get through 5 minutes, like, let's get through this hour. You're feeling anxious right now. Let's just get through this hour. Let's just get through the rest of this day. Let's just make it until dinner time. Let's just make it until the morning. If you're feeling anxious at night, like, let's just wait. Let's just make it through to 8 a.m. when you can call your doctor as soon as the doctor's office opens. And so if you break it down, it can into bite-sized chunks. It can just be a little bit easier to manage and think about it that way. But I think if we expect that that those thoughts are going to come. Hopefully, the goal is that they don't completely overwhelm you and, you know, affect your ability to function in your day to day life, that you can still enjoy your life, but just knowing that those things are going to come and preparing for them and having a strategy to how to get through them can be just really, really helpful. And it was for me. That's how I got through my pregnancy after loss, 100%.
Yeah, I love that. I was going to ask you, my next question was going to be any last words for the community, but I think you said it all right there. And if there's anything else you want to say, I'll give you the floor back and then tell us where we can find you on Instagram and how we can get our consults with you for possible coaching and help with you.
Yeah, my final, I guess, piece of advice is, if you are in this community, you are seen, you are loved, you are supported, you are not alone. I know that these journeys of infertility and pregnancy loss and just all the many diagnoses and nuances that come along with that can feel really, really isolating. And your story might not look like mine. My story may not look like yours, and that's okay. We are a part of this amazing community that I wish nobody ever had to be a part of. But there is real sisterhood here. There is real support here, and I just want you to know more than anything else that you're not alone. And if you did want to connect with me, as I mentioned, I'm a certified fertility coach, trauma specialist, and full spectrum doula. So I work with people all on the journey of trying to conceive, who have experienced loss or are going through a loss, are pregnant again after a loss, or are pregnant after infertility, all the way through postpartum support. So, wherever you are in your journey, if you just feel like you need a little extra support, I tell all of my clients, you don't need me to get through this. You don't need a coach or a doula to survive this. You are resilient. You've been through so much. You've been surviving every day and getting through this without me. But if that support is something that you want, I would love to walk alongside of you and support you. And so my business is called Catalyst for Courage, and you can find the website catalystforcourage.com. My Instagram is at Catalyst for Courage. And then my personal Instagram is Lindsay A. Blair. So whichever, if you want to connect with me on a personal side and that is mostly just me sharing about the babies. So use your discretion about that. I don't know where you are on your journey. I know sometimes hearing stories about pregnancies and babies can be hard, and so don't follow my personal account if you're not in a place to see babies, because that's pretty much all that one is. But my business account is full of, I share a lot of tips and tricks for getting through IVF and trying to conceive and going through loss and pregnancy after loss. So if that sounds like something that you would find support in, I would absolutely love to connect with you.
Well, thank you so much, Lindsay, for sharing with us your story to motherhood and giving us a bit of hope and encouragement today, as well as just being a voice girl for all of us and for those coming after us, which is going to be the key component here. Those coming after us, and still in the thick of things. And thank you, friends, for tuning in to Infertility and Me. You guys know where to find me at Infertility and Me podcast on Instagram, as well as our private Patreon community. You guys know where to find me. And I will have all of Lindsay's details in the show notes for you guys to tap and go and connect with her on Instagram and or through her website. And it's going to be in the show details whether you're on YouTube or watching or listening on your favorite audio platform. So that's it for today, guys. I hope this gets you over your hump for the week. And if you want to reach out to Lindsay, make sure you tap the details and follow Catalyst for Courage on Instagram. Peace and blessings.